وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي، أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر وعبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
Good morning and thank you for being with us. This is Khalil Hachem with the Local Connection. I'm the editor of Michigan.com, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. It's Friday, February 19th, 2021. It's a cold, cold day. We have a lot of snow outside. Stay warm. It's going to get better next week. I think it's going to have some fall. The snow is going to thaw out. The temperature is in the 40s, some of them in the high 30s, low 40s. We're looking forward to that. Thanks again for being with us, and the number here is 248-557-3300. Please give us a call if you have a question in Arabic or in English or comment about the topics we're going to be talking about. There's a lot in the news today, and one of the biggest, the first thing we're going to do is we're going to wish everybody and send some love and prayers to everyone in Texas. They're dealing with some unprecedented, cold and loss of power and some disasters there. So we wish them well, and we hope that they'll be relieved very soon. It seems that most of the people have gotten their power back, and some are on the way. So our prayers and thoughts are with everyone in Texas down there. The other thing in the news is, and we have done quite a bit on it, and we're going to continue to do segments on the vaccine for the coronavirus, even though there has been a lot of information, but people seem to be a little bit apprehensive about it. And I understand that there has been a lot of misinformation and a lot of confusion. And because, first we didn't know much about the virus, and now we learn more. And then there's the social media, misinformation. And then we asked our friend, Dr. Lama Hsaiky from Beaumont, to be with us. Good morning, Dr. Hsaiky.
Good morning, and thanks for having me on your morning talk this morning to share some facts regarding the vaccine.
Yeah. Did I say your name correctly?
You did. Thank you.
Okay, wonderful. Dr. Hsaiky is a manager of clinical and quality professional pharmacy service at Beaumont. She's also an antimicrobial stewardship program at Beaumont Health. She's a lead there and an adjunct professor, a clinical associate professor at Wayne State University College of Pharmacy in Detroit. Welcome again. And I'd like to remind our listeners the number here is 248-557-3300 if you have any questions to understand more about the virus. We're going to start immediately. Is what's the messenger vaccine? How does it work, and how is it different from other vaccines?
That's a great question. I think before I go into how the virus works, I think it's good to just kind of shed the light on some of the, just what we've been doing over the last months in order to control the COVID-19 spread and then put an end to this pandemic. Many of them have been, we've put in many layers such as social distancing, masking, social restrictions, quarantine, as well as isolation, along with many other infection control measures that have definitely slowed down the spread. But an extra layer of sustainability is needed, which in this case is the vaccine. Vaccination have been technically the most effective and safest way of achieving this goal, and there's ongoing global efforts to develop the most effective and safest vaccines for the coronavirus. So just to kind of to give you a head, I think the main fear that's been happening is, do I trust these vaccines since they came on the market or as an emergency utilization authorization very quickly? Does that mean they're not safe? Well, I think there's an understanding since, like, over the years, this is not a new methodology in any way. There are two different ways to produce vaccines. The traditional way, which takes years, and the paradigm for vaccines that are specifically made during a pandemic. We haven't had pandemics in decades, or at least that affected us here in the United States. But since the call of the coronavirus, about 250 vaccine candidates are actually going under evaluations at this point. 69 of them are in the development phases, which are the clinical phases. They are utilizing or testing in humans, ranging anywhere from hundreds to thousands of patients. And then the numbers kind of keep, slowly they're coming out as emergency utilization. And those range from one-time doses to 2 doses to 3-dose series. And some actually might have oral methods of administration. And so there's a lot of hope in regards to that and also the future. In regards to the mechanisms that are being tested, besides the mRNA, there are about 8 different types of vaccines that are tested. They range anywhere from those that are containing a whole virus, either in a weakened or an activated form, to others that contain part of the viral structure, or those that really use our cells to produce those viral proteins in order to induce that immune system. And that's what really are referred to, or the mRNAs tend to fall in that category. But the bottom line, they all rely on the same basic principle of tricking our body to inducing protective immune response. So if we were to catch the real virus, our body has the immunity in place, or antibodies is what we refer to fight it before it attaches to our cells, and it starts replicating and induces what we call infection and all the complications that come with it. So
that's with the mRNA, right?
That's all of the vaccines that are being studied. Really, they're all focused on that. In regards to the mRNA specifically, I'll go more into depth in this just to kind of explain it to the audience a little bit.
Sure.
So the mRNA molecules are technically, they're natural parts of our own human cells. They're not unique or foreign to our bodies. And that's how our cells work in our bodies. The RNA viruses that are or the mRNA virus vaccine that's being injected in us at this time, they're not live vaccines. They're not made of weakened virus and don't really use any live virus material that's injected in our body. And I think that's really what we need to address. There's nothing live about it or anything from that virus that's getting into our body. So at this time, I just need to use your imagination, since I'm not really drawing in front of you right now, to explain it to you on a board.
Sure.
So just kind of bear with me too. And then you're welcome to stop me or ask any questions if, or for the audience to call and ask questions if it's too confusing. So how do they work is the biggest question. So the vaccines work by delivering a piece of this messenger RNA or mRNA, which carries a synthetic genetic coding. So it's not a real virus, it's just that genetic coding of the virus. It's covered by a lipid coat to help it stay stable before it's injected into the body, because they tend to be very fragile and unstable to stay outside of a human body, like just RNA in general. And then what happens when what's injected, it gives our body the instruction on how to make protein molecules, which in that we're referring to the spike protein. We're all familiar with how the virus looks with all the spikes that are on it. We've all seen it either on TV, or that's what it's known for, the virus with the spikes on it. Once the vaccine is injected in our muscle, some of our muscle cells of our own body take that messenger RNA instruction in the vaccine, and then they make harmless proteins. So they're very harmless, and those are called the spike protein, which are found outside of the COVID-19 virus. Our muscles then destroy the instruction on how to make the spike protein, and it's just gets dissolved. The RNA does not stay around, or in the messenger RNA. The easiest way to think about it is really as a sticky note. It's if I write my own message for the day or leave a message for someone, once that message is received, the paper is gone. It doesn't need to stay for any reason. And think about the messenger RNA as it's the same method. It sends a message to your body to make these proteins, and it's gone, and it does not stay in your body. It does not stay in your cell, and it definitely does not go into your nucleus, which is where our DNA is located. And I think that's been the main concern.
Exactly.
Do these RNAs cause DNA mutations or any changes in RBY? It really does not even enter into the nucleus. This is where the confusion is when people hear the NA in the mRNA. They think that it's going to change their DNA, which is really has no work in there. Is that correct? No, not at all, because it's more of a messenger for a purpose, which is that to make that protein against the spikes. And that's all synthetic, like I mentioned, nothing real, that it's not coming from a real virus. It's just genetic material from the virus to trick your body to make these proteins. Then when that happens, what happens then, the new spike protein that your body then, or the cell makes, they'll go on the outside of our own muscle cells. And then our immune system, if it's working appropriately, and that's the role of having an immune system, to recognize things that are foreign to us, and that's how we stay healthy, right? Like avoid toxins, things we eat, and just foreign material that we get exposed to daily. But also it gives our body this time to recognize these spikes and make immunity against it is the easiest way, or antibodies. And that stays with us as a memory. So if we ever catch that infection, the body will immediately attack it. And before it attaches to our cells and starts replicating and go and infect other cells and having symptoms of COVID. People might have symptoms, but that's just the body's response to, if we ever catch the virus, to block it before it gets into our cells. So that's really the bottom line of how it works.
Yeah, exactly. If we, if we're vaccinated and then we catch the virus, can we still transmit it to others?
If we're vaccinated and if we catch the virus, can we transmit it to the others? Again, the goal of the virus is to hopefully prevent us from getting infection, but it all depends, right? It takes time for the vaccine to work. It doesn't work from day one after administration. It also depends on our own immune system. If it's working appropriately, will it develop that immunity? And that's why there was a small portion of patients, about 5%, that did not develop possibly immunity, and they did catch the virus. Transmission, yes, if you catch the virus, you will still transmit, because if you get infected with the virus, and that's why I think we're still asking patients to wear the mask, because with the vaccine, it does work based on the data that we have, and once our body develops that immunity, it should last for at least 6 to 8 months, but we still need to follow basic infection control measures. And I think it taught us a lot, this pandemic, where we have to protect ourselves regardless if it's a pandemic or no. If there's seasonal viruses, wear your mask. Don't avoid big groups. But I think other countries that massively vaccinated their population, about 90% of their population, they saw at least a 40% reduction in COVID infections and hospitalization related to COVID. We're not at this point, at that point in the U.S. at that time, because we're still at very low numbers of vaccination. So the time will tell what is the rate of transmission. And once we have that high number of vaccination.
Absolutely. So the only two right now we have is Pfizer, Moderna, and we may have Johnson & Johnson later, but the Pfizer and Moderna, there are 2 shots. What's the time difference between the 2 injections?
Okay, so like you mentioned, those are your 2 mRNA viruses, what we call them, and those have the emergency use authorization by the U.S. to use in the population. They met the criteria for that. In regards to the time between the 2 injections, they are both a 2-dose series. For the Pfizer, they're different doses. The Pfizer is about 30 microgram. It's the same dose for first dose and the second dose, and they're 21 days apart. For the Moderna, they're 28 days apart. And the reason there needs to be that duration in between, it's really to induce that boost. The first dose is intended to give your immune system that initial recognition, and then give yourself about 19 days, because it takes sometimes up to that long for some patients to develop that initial response, depending on their immune system, if there's a delay, and how we respond to things. But you can ensure at least there has been that recognition. Then you boost it with the second dose, and that works the same for both vaccines.
Sounds good. Now, who's getting the vaccine right now?
So, in regards to how it works, I think that's another confusion that's been, why is it not available?
No, not how it works. Yeah, who's getting the vaccine right now?
No, I know. The process is what I'm referring to. So initially for the prioritization, like when it was FDA approved for that emergency utilization, they approved it for two groups, which was the healthcare workers and the nursing home residents, and that was in December. So after that, it's left up to the state to decide who are the second phase and the third phase, and because it goes in phases, mainly because of production and allocation and availability of the vaccine. So in the state of Michigan right now, so the healthcare workers can get it, long-term care residents and staff, anyone over the age of 75 that's not covered in that. They're not healthcare workers, school teachers, childcare staffing, are people that are dealing with agriculture and food processing workers, so restaurants and those types of workers, and the essential frontline workers, and anyone over the age of 65 is now eligible. So that's what's called phase 1A and 1B. And by the spring, we're hoping we can expand these phases further now that there is more production of these vaccines, specifically for the Pfizer vaccine, to make enough to cover the whole nation. But that's been the main struggle, is the allocation and the availability of the vaccine.
Here's a question that everybody keeps asking. If somebody, gets the virus, do they need to be vaccinated?
So the question is relevant. When patients get the virus, not everybody develops immunity, right? The viral infection ranges from mild to severe. And I think our body's response is very different to how when we catch that virus. And it's very hard to tell who has that immunity where to protect them long term. And we know even from the virus, the long-term immunity now we know is about 6 to 8 months. We don't know if it lasts longer. Or if you've ever had the virus, will you have that long-term memory? And we have different strains now that we're seeing coming, the African strain, the UK strain, and also the Brazilian strain. And even if you had a protection from a strain that you caught at one point, does that mean it gives you protection for future viruses? That's still unknown at this time from an own immunity type response. So for that reason, we say yes, it is recommended to take the vaccine, mainly because these vaccines are easy to make eventually, and with future mutations, it's easy to recreate new vaccines with new things to protect with the new strain. And I know with the Pfizer and Moderna, they are protective against the new strains that we're seeing now circulating across the globe. And that's how I say it, protect yourself and get that extra protection. And there's no contraindications whatsoever.
Is there anything I haven't asked you that people need to know?
I think some of the questions, does it work? I think it's probably the best efficacy that we've seen with vaccinations. They both work at over 90%, 94%, and that's across different ages, different ethnicity. I think that's another question that has been asked, and also gender. And I'm speaking to an adult population. We don't have any, or at least it's not approved for the pediatrics right now. It's also strongly recommended now to provide the vaccine, even though there were minimum patients that got pregnant in these studies. However, from those that got pregnant after getting the vaccine, there was no harm related in the vaccine group. So there's so much harm from the COVID infection if someone is pregnant and they catch the infection and all the complications. It's highly recommended to provide or offer the vaccine for pregnant women and even those that are breastfeeding, mainly from a protective standpoint, and since the safety is very well tolerable. And I think the misconception that I hear all the time, the vaccine is making me sick. Does that mean I got COVID infection? I clarify where it's not a bad thing to have side effects. That means your immunity is actually building some antibodies. It's our way of responding to foreign things. And those tend to be very mild in nature compared to other vaccines that we have in the market. And just the standard, like muscle aches, sometimes fever, chills, and they tend to last for 1 to 2 days. And it's only happening in 1/3 of the patients, and a little bit higher with the second dose, but it's still less than 50% of the patients are having those. But I also wanted to clarify, even if patients don't have these side effects, does not mean the vaccine is not working. It's just our way, our bodies respond differently to things, but it's nothing to be afraid of. The complications from COVID, and I always remind, are way higher.
Very quickly, because we're running out of time, please. Yeah.
That's fine.
Very quickly, because we're running out of time.
Yes. Okay,
sorry,
so
go ahead.
I think the other
finish your
question that you have is the registration. The best way to figure out what sites are offering the vaccine, if you go to michigan.gov/COVID vaccine, and you can find sites in your county. Beaumont also offers vaccines. As the state allocates, we have 2 huge clinics, and that information can be found at beaumont.org/mybeaumontchat, and they have information on how to register, create an account, and we do have a random process now to select appointments, mainly because we have over 1 million patients that enrolled or registered, and the state has not allocated enough vaccines. But with time, hopefully, all that will be available, and that will be available for all patients to not just a random process. But we have to do it this way just to minimize bias.
Wonderful. Thank you so much. I really appreciate you taking the time to be with us to share this valuable information. We appreciate everything you're doing for us to keep us safe as a community and all the hard work that you're doing. Thank you so much.
Thank you very much. Thank you.
Absolutely. We're going to take a short break. We'll be right back. Please stay tuned.
Are your hands feeling numb? Do you feel pain opening up a jar, turning a key? Are you noticing that your elbow and your shoulder are becoming stiff? Or were you recently injured in your arm? Hello, I'm Dr. Al-Majid Katranji, and at the Katranji Hand Center, which just recently opened down the street from the Somerset Mall, we can provide you with the latest in hand, wrist, elbow, and shoulder care. Visit us at www.katranjihandcenter.com to learn the latest techniques that we have to offer you, and I look forward to taking care of you.
Visit us in Troy at 1565 West Big Beaver Road, Building F, or call Katranji Hand Center for an appointment at 248-869-4263. That's 248-869-4263.
Kashat's Mediterranean Market and Shish Kebab offers a great array of your favorite Mediterranean meals. Meals range from lamb specialties, shawarma sandwiches, seafood dinners, and they offer special big trays of your favorite food, plus much more. Kashat's Mediterranean Market and Shish Kebab address is 32839 Northwestern Highway in Farmington Hills. Their phone number is 248-538-9552. That number again is 248-538-9552, and the supermarket is open from 8 a.m. to 9 p.m. Kashat's Mediterranean Market and Shish Kebab will definitely leave you satisfied.
At Top Rehab Physical Therapy Clinic in Dearborn, we provide effective physical therapy sessions in order to limit pain and discomfort. Top Rehab provides physical therapy care for any diagnosis prescribed by a physician, and we regularly see and treat conditions such as stroke, TMJ, fibromyalgia, sciatica, joint pain, and more. We use a variety of pain management methods, including modalities, soft tissue mobilization, and therapeutic exercise. If you're in need of physical rehabilitation or physical therapy, get the highest quality health care at Top Rehab. Most insurance is accepted, and we're open Monday, Wednesday, and Friday 8 to 6, Tuesday and Thursday 8 to 5, and Saturday 10 till 2. Call for an appointment today at 313-846-0555. That's 313-846-0555. Choose Top Rehab Physical Therapy Clinic on Michigan Avenue in Dearborn. Life's too short to be in pain.
Welcome back, and thank you for being with us. Now we're going to turn to a different topic about one of the largest Arab American social services organizations that has made a tremendous difference in our lives over the years in this community. And thanks to the leadership of that organization for its hard work to serve this community. And after 40 years with that organization, its leader, Hassan Jaber, who has done a tremendous work, is moving on to a different work. And the board has selected Ms. Maha Freij to be the CEO and president to take over. And Ms. Freij is with us this morning to tell us a little bit about the organization and the change. Good morning, Ms. Freij.
Good morning, Khalil. How are you? Good morning to you, your team, and all of your listeners.
Thank you so much. We really appreciate you taking the time to be with us. We're going to miss Hassan. He's been at Access for so long. He's done so much work, and you've been at Access for some time, and you have been in leadership for some time, and you've done a great job as well. So tell us a little about the change and where we go from here.
Absolutely. So Khalil, let me start by what you mentioned about my good friend and brother and colleague, Hassan Jaber. He's an individual who has tremendous impact, has it, and will have tremendous impact on so many people who get the pleasure to work with him or benefit from his brilliance and from his work. And he's moving to, and I want to congratulate him on the next step of his journey. He's moving to dedicate more time to the causes that are most important and closest to his heart. He's committed, as you know, so much to social justice and to equity. And Hassan, by making this move, will be able to work on, platform for policy and advocacy programs that will ensure that equity and justice in the community are being adhered to and supported. I myself, as you said, I've been also with the organization for a long time. It's been 30 years for me. And I've seen the organization grow and expand, and I see our team. So what's unique about Access is that it's not a one-man show. That's what's so beautiful about this experience. This is an organization that worked so hard, and I take so much pride and honor that I am one of the most supportive and played major leadership in ensuring that the organization that we love so much, that's called the Arab Community Center for Economic and Social Services, Access in short, it moves from being just an organization to being an institution and being an American institution. So being in touch and to the needs and relevant to what's happening in the community doesn't mean we shouldn't build our capacity, build checks and balances in place, and ensure that our institution is here to stay, and it's not tied to just one passionate person that when he or she gets tired or dies, everything goes away. And Access is here to stay. Alhamdulillah, we are so proud of that. And this transition proves it, Khalil. We had this beautiful transition, and succession plan, and we have so many talent within our ranks, within the organization, that the leadership is there beyond Hassan, beyond me, and beyond the people who will come after me as well.
Absolutely, absolutely. So what's for the future? I mean, you offer a variety of different programs in this community. What's the future holds?
So, as you know, what's special about Access, that it is a very well established and well run Arab American organization. As I said, it's an American institution, but we have an identity, an Arab American identity, and we're Arab American led. And we are unique and really carved a beautiful place for ourselves in terms of being a human service provider by being an expert at providing a holistic approach of services to the community in Southeast Michigan. And when I say the community, it's not only Arab American, it's community,
absolutely,
in Southeast Michigan. And, through workforce development, social services, medical services, mental health, research, arts and culture, name it, education, we're in 26 schools in 5 cities. We see 2,000 kids a day. So it's like we do a lot of stuff in Southeast Michigan that holistically really is designed to support the entire family and not only the person who comes through our door. And we pride ourselves at being nimble and being relevant to what is so important in the community. So coming forward, I would say that in our big plans, building our capacity and institutionalization and our checks and balances is big for us, always. But in addition, I mean, you saw how we responded to the COVID crisis in ways that no other nonprofit organization did, not only within the Arab American community, but in general. What's big for us, definitely, in terms of these plans that will affect the region, is that we want to have a very serious solution to the opioid addiction problem by establishing a comprehensive detox center and treatment center for opioid addiction. And also, we are looking at models that will answer the need as major changes are coming to the workforce, where because of technology and otherwise, and also the pandemic, a lot of people will find themselves, out of work, and they maybe have to be trained to do something totally different. So we are preparing for that in a big way. These are the big things that will affect the region that we have in place. And as you know, Khalil, nationally, we have this comprehensive approach through the Arab American National Museum and the National Network for Arab American Communities and the Center for Arab American Philanthropy to provide a comprehensive concept that is designed to unite and empower and strengthen the voice of Arab Americans on a national level through the art, through community building and institution building all over the country, community organizing and advocacy, and strategic giving. And it's all tied to the vision that guides us. Access's vision is a just and equitable society with the full participation of Arab Americans. And that our participation requires all of the above. And so we are equally working on the national agenda as we work on the local agenda at the same time.
And we appreciate all you do. Is there anything you haven't asked you people need to know about this change?
No, all people have to know that Access is led by multiple leaders. It's not one person. On the C-suite, my two colleagues, Lina Harajli and Wissam Fakhouri, are going to be working hand in hand with me in leading the organization. Our board is so strong, led by Dr. Ahmed Izzuddin. And then our community leaders, they are the ones who drive what we do because we don't take their support for us for granted. We know we have to earn their support and we have to produce in what we say and we have to listen to them. And having all that and having the dedicated, brilliant staff that we have in the organization, the brilliance of the board and the leadership of the board, and our community, our supporters in the community, I am not worried about anything that will face us. We will come, inshallah, on top of it, and we will do, at the end of the day, I keep saying to my colleagues that as long as we go, when we sleep, we are comfortable, our conscience is comfortable, and we do our best with excellence and with utmost attention to every single detail that's required to make it better for the people around us, then we are winners. That's all we can do, and we are committed to that, and that's our promise to the entire community.
And we appreciate all you do, and we appreciate you taking the time to be with us. And again, congratulations, and thank you so much for being with us.
Thank you so very much. I appreciate it, Khalil. Shukran.
Bye-bye. Absolutely. Bye now. Bye.
Bye.
We're going to take a short break. We'll be right back. Please stay tuned.
Enjoy the first Syrian-style cuisine in Michigan. At Damas Cuisine and Catering, you'll find a wide selection of Syrian foods and sweets in our menu, like frike, poisi, grape leaves with steak, mashawi platter, hot mahashi, char-grilled kebab, shawarma, and much more. Get super fast delivery from Damas Cuisine and Catering right to your door. Order online at damascuisine.com/menu and track your order live. Damas Cuisine and Catering, 28841 Orchard Lake Road in Farmington Hills. Call 248-987-4985. Life is a nonprofit charity that's provided humanitarian aid and development to people and communities for over 25 years, regardless of race, color, religion, or cultural background. When disaster occurs here or around the world, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. Please help improve these efforts. Make your tax-deductible donation to Life now at lifeusa.org or call 248-424-7493.
Ziyad brand. Quality products from our family to yours. Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Donna, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
Welcome back, and thank you for being with us. This is Khalil Hachem. We've talked so far about the vaccine, and we also talked about access and some of the services they do, the change over there. And one thing Ms. Freij mentioned is the addiction. And this is a big issue in our community. And I've asked our friend Beaumont Hospital to be with us this morning. She's been doing some great job in the community and wanted to recognize that. And, addiction is a huge issue. So we wanted to really learn a little bit more about how big the problem is and what can we do and how can we recognize some of the signs to help our youth. Batul, good morning.
Good morning, Khalil. Thank you for having me.
Absolutely. Thank you so much. Tell us a little bit about you, what you do in the community, and then we can talk about addiction.
Sure. So my name is Beaumont Hospital, and when I decided to go back to school, I wanted to address an issue that I knew was stigmatized within my community. I wanted to help a population that I felt was misunderstood. Therefore, I attended the University of Detroit Mercy, and I specialized in addiction. And that is what my degree focuses on. With that being said, I serve my community in regards to prevention. So I've gone into the Dearborn public schools. I've educated our youth. I've talked about mental health, the dangers of vaping, smoking, hookah, alcohol, and whatnot. I also do work that's a little more intensive than local community organizations. I actually go into homes. Families call me and tell me we have a loved one that has a drug addiction and we don't know what to do. So I actually go inside of people's homes. I meet with the families. I meet with the person struggling with the drug addiction. And we develop treatment plans. I provide education. I teach them what an overdose is, what to do if they recognize an overdose, and things of that nature. So that's a little bit about me, just in a nutshell.
Absolutely, yes. And how big of a problem is that addiction?
So, sure. Like in every community, Dearborn Heights, Wayne County, we are no exception. The epidemic is ravaging in our community as it is in every other community throughout the United States. One thing that I like to highlight is that addiction does not, it doesn't see race, color, religion, or ethnicity. It affects all of us equally. So it's definitely an issue of concern in our community. It really is, especially the opioids.
How does it hit mainly young people? Is it middle age? Is it or people of all ages?
So what we're seeing right now was, 10 years ago, Khalil, they used to prescribe opioids heavily. And so now what we're seeing is a generation of individuals that are in their late 20s, 30s, and they have a opioid addiction because they were being prescribed it heavily through their doctors. Now that there's strict regulation, they're not allowed to do that anymore. So we have a generation of individuals that are just drug seeking on the streets because their doctors can no longer prescribe it. And we also see it in the population of the elderly because they're in pain and doctors prescribe them pills. Doctors prescribe them benzodiazepines for anxiety. And there's just a lack of education. Therefore, the medications get abused. But typically, it starts in early adolescence, I would say 18, 19, 20, and then it works its way up.
What are some of the signs?
Sure. So some of the signs, and I want to address this, that the signs that I'm talking about is adolescence. So we're talking about, for example, like high school kids, college kids. So this is the target that I'm giving the warning signs about. So the physical signs that parents can see are, red eyes or dilated eyes, excessive sniffing or nose running. So it might seem like they always have a cold. I had a mom tell me, my son always has a cold. He's not getting over this cold. And I said, no, that's withdrawal. So sometimes parents don't even make the connection. If they always look pale, or if they're not eating the way that they used to. Mothers always tell me, I'm washing my son or daughter's clothes, but their clothes don't fit them the way they do. So if parents notice a drastic weight loss, change in eating habits, and one thing I really want to highlight that parents don't pay attention to is if their son or daughter comes home and they're spraying a lot of cologne or perfume, they're usually trying to mask some type of odor. So if your son or daughter didn't, come in the house smelling like, oh my God, I could smell your perfume from miles away, they're trying to hide something. So those are warning signs.
What kind of odor are they hiding?
Sure. So oftentimes in adolescents, teenage kids, college students, they try to mask the scent of marijuana. Okay. And with all of the clients I've worked with, they have all started with marijuana and gradually work their way up to other drugs.
Other medication, yeah. And what do you do right away when you recognize, your kid is not there's something questionable about it? Do you confront the kid or do you talk to somebody like you?
Sure. So I would say really it all depends on the relationship between the mother or the father and the child. In our community, unfortunately, there's this big thing where we can't we can't say anything, the people will find out. So really we need to
We need to stop caring about the people and start connecting with our children. Now, if families have a close relationship with their child, I would say just have an open conversation like, hey, I've noticed these things. Should I be alarmed? Is something going on? Is there something we need to talk about? Or if they don't have a close relationship with their child, or they feel like their child will just deny it, they can reach out to a professional like me, and there are ways that we can address it.
Absolutely. From your experience, does the language barrier play a role here? We're like the family, the parents don't speak English well, they don't understand what's going on, and their kids are going in a different direction.
Definitely. It's huge. And it's the lack of education. And, there's a lot of nonprofits that are doing groundbreaking work. They're doing excellent work. But a lot of these families, they don't have access to technology like others do. They're not connected like other people are. So my role is critically important because this is the population that I reach. So I go into the home and they have no idea what's going on. They don't even know what their children are taking. They don't even know that their son or daughter is overdosing. They think they're fainting. They just simply don't know.
Yeah.
So the barriers are huge, and they exist.
Yeah. And we normally notice the people who lose their lives, but we don't notice the people who are suffering, and they're suffering, their parents are suffering, and people around them are suffering. And, there are a lot of wasted lives out there. So it's just amazing.
Yeah, addiction is a family disease. It really affects everyone that's involved.
It's very costly,
it hurts everybody
too.
in the family.
Yeah. I've seen people spend a lot of money trying to help their children, and they have not been successful, depending on what kind of addiction it is.
Definitely. So, private pay institutions are extremely expensive. And when I go in and I assess someone's son or daughter or a client, I always look at their readiness to change. How ready, how motivated is this individual to change? And, unfortunately, you can't force it on anybody. It's either people are ready or they're not.
Absolutely.
It can be very costly.
Now, when it comes to, when somebody goes through a program like that, they're going to need a lot of support. And do you counsel the parents as well to provide that support?
Yes. I work with everybody that's immediately involved. I even do case management, so I'll meet with that individual's psychiatrist. I'll meet with their counselor. I'll meet with their addictions MD. So I bring everybody to the table because when it comes to addiction, really it's all hands on board. It's a team effort, and, the family gets educated, the loved ones get educated, and I also bring the entire medical team together so that we can work collectively.
Yeah.
So that there's no gap in anybody's treatment.
Yeah. I'd like you to stay with us. So we're going to take a short break. We'll be right back, and then we have someone with a question on hold. Please stay tuned. We'll be right back.
When you're looking for the best in optical care, Dr. Imad Nakash is your doctor to see. With years of experience and thousands of successful procedures performed, you can trust your eyes to Dr. Imad Nakash. See Dr. Imad Nakash and his professional staff for your eye care needs. There's 2 locations to serve you. In Hazel Park, call 248-336-3937. 248-336-3937. In Rochester Hills, call 248-299-3937. That's 248-299-3937.
Get ready for an amazing experience at Ishtar Restaurant on 15 Mile Road in Sterling Heights. Enjoy excellent hospitality from owners Ali Al-Baghdadi and Fatty Bonham, serving the best in Mediterranean food. Try Chef Ali Al-Baghdadi's famous shawarma, the best Iraqi grills and food, and the best Arabic and international dishes. Dine in our authentic atmosphere or take out. Call 586-698-2585 or check us out on Facebook. Ishtar Restaurant practices all CDC guidelines and is open every day 11 a.m. to 10 p.m. Have an amazing experience today at Ishtar Restaurant, 3625 15 Mile Road, Sterling Heights.
Are you going to start a restaurant or a grocery store soon? Do you need floor plans and designs? Call Naji Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Naji Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design, new location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Naji Abood, 734-744-9796.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shama is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shama has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shama is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shama at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
Welcome back, and thank you for being with us. We're talking to Batul Maki about addiction. It's really a horrible, disease in our community and in every community. And I mean, the community is no different, but something that we need to face on. And we have Jerry on the line. Good morning, Jerry.
Good morning, Mr. Khalil Hachem, and thank you for taking my call. My question to your guest, Ms. Batul Maki. Ms. Batul Maki, thank you first of all for your service to the community. My name is Jerry Haba. My question to you, Ms. Batul, addiction indeed is a disease. When it comes to alcohol, gambling is another problem. And recently, the state of Michigan law allow
What's the question, Jerry?
Gambling online. Is your organization, Ms. Batul, try to help the citizen against gambling addiction, because that's a disaster. So I would appreciate it if you could give us some details what your organization could do about gambling disease addiction. Thank you, and God bless you. And thank you, Mr. Khalil, for taking my call.
Absolutely, Jerry. Thank you for your call. Yep.
Thank you so much.
Ms. Mackey, is gambling part of what you do?
So gambling is a process addiction, and unfortunately, it's not something that I do. There are people that specialize in that area specifically. However, I can, give a resource. There's a number that people can call, and they can help them for gambling. If you're ready, I would love to share that number on here. It's 1-800-270-7117. Again, it's 1-800-270-7117. And this is the Michigan Problem Gambling Hotline. They have plenty of resources, and they can help, guide in the right direction. And I'm so sorry that, that's unfortunately, I focus on the drugs, the substances themselves, rather than the process addiction, such as gambling.
Yeah. What's a success rate in that you notice in the community when working with the addiction that you deal with?
Sure, that's a great question. So really, the success rates are not high. Addiction is a very, very vicious disease, and I encourage parents, the earlier you detect and the sooner you see warning signs, intervene. Do not wait and brush it off and think that we don't let the denial win. Because usually families will reach out to me when the addiction is full blown. And it's very hard to tame it at that point. So I encourage families that if you know your son or daughter is smoking marijuana, you need to intervene as soon as possible. If you know your son or daughter is being prescribed opioids or benzodiazepines such as Xanax or Klonopin, you need to intervene. So I encourage family members to, get a second opinion if their son or daughter is prescribed medication, especially if they see the dentist, they get their wisdom teeth pulled. If they're in high school or in college and they play a sport and they get injured, or if they're involved in an auto accident.
Yep.
So parents really need to be vigilant. Sure.
Yeah. Good morning, Layla.
Oh, we just lost her.
No.
Okay. Please call back. We got a few minutes left. How's the community working with you, Batul?
Of course. So I first started working with the Safe Substance Abuse Coalition with Ali Sayed and Hajj Rabi' Darwish. I worked with them for about 3 years. I currently collaborated with LAHC. We just actually released a video yesterday, and it's strictly in Arabic, about how to recognize an overdose and how to administer Narcan. So I work with different nonprofits. I work with for-profits. I work with physicians. Really, this is a community effort. I can't do it by myself. Nonprofits can't do it by themselves. So I say all hands on board. This is going to take all of us.
Absolutely. What is there any work with the faith community as well, and what can they do to help you?
Oh, well, that's a great question. I have not, I went to one of the mosques in Dearborn. I left some of my business cards, but I didn't really get much feedback. I believe that is an area that needs work. We really need to work closer with faith leaders, and that is on my agenda.
Absolutely. Now, is social media contributing to the problem?
With young people, definitely. So, the high schoolers, the college students, the music they listen to, the games they play, the TikToks, the things they follow, it definitely is it's a negative. It can be positive, but it's more so negative on our young population, unfortunately.
Absolutely. How can people reach you if they need help?
Sure. So, of course. So my phone number is area code 313-618-6485. People can also go to my website. It's www.bmackeyconsulting.com. I do operate my own consulting firm, so I help people and families that are suffering with addiction and also with their mental health.
Sounds good. I want to thank you so much for taking the time to be with us, to share this information. And this is a very important issue. And then, and I urge everyone to work with you and everyone who is working in countering this horrible issue in our community and every community, So I don't want to single out our community, but, what we're talking about our community here. Thank you again. I really appreciate you taking the time to be with us. Thank you. Absolutely.
Thank you. Bye-bye.
And I want to, thank you. I want to thank everyone for listening. I would like to thank Dr. Lama Hsaiky for being with us. We appreciate all the information she provided about the COVID-19, about the vaccine, rather, and, where the difference between the different vaccines and how they work, and that we don't need to be, afraid of it. It does work. And then, where we can sign up for it. And then, whether we can, we should take it or not. This is really was great information. I'd like to thank Ms. Maha Freij of Access and congratulate her. And I'd like to thank Batul Mackey for being with us to talk about addiction. Thank you, Mike, for a great production. Thank you, Jerry, for calling. And thank you, Layla. I'm sorry we couldn't take your call. And have a wonderful, wonderful and safe weekend. Thank you, everyone, for listening. Bye now.